Now, specialist training, or an alliance for specialist training in drug-resistant TB, you are part of an initiative called START. What's it all about?
So the START actually is a new training program that was recently launched by Janssen, and it encompasses many aspects of specialist training for drug-resistant tuberculosis. So we are a group actually of specialists from the region, from the Asia Pacific region, that we were invited by Janssen to develop this website by inputs of resources and important things related to tuberculosis.
What did you perceive as the hurdle to overcome then?
I think it's probably involving many people actually entering this website and being part of the members, as members actually of this website. But we're trying actually to work on this right now by trying to disseminate actually the word of this website so that people can be involved in this initiative.
What do you want to achieve then against drug-resistant TB?
Because we know that drug-resistant TB is a growing problem right now in the world, and we know that actually most of the cases they are undiagnosed, particularly in our region. So we're trying actually to probably increase the training and knowledge among physicians about this disease.
Okay, so there is lack of knowledge at the moment. What are the 2 or 3 key areas that you'd like to mention that people should know about?
Well, basically actually how to first actually reach initially the diagnosis of TB itself. So drug-resistant tuberculosis is part of the big umbrella, let's say, which is like TB itself. So first diagnosis of TB, and then how to actually know that this patient actually is resistant to tuberculosis. And then of course, what are the treatment options that's available that might be leading to a better life actually for the patients of drug-resistant tuberculosis, and how to cure those patients, of course.
Can you give me an example, a simple example of what kinds of things have gone wrong up until now?
Well, basically, you mean in the region, like in relation to the drug-resistant tuberculosis? Unfortunately, of course, the limited number being actually diagnosed first and then enrolled
missing
in the treatment.
Patients.
Of course,
missing
we have
patients,
many missing. I mean, definitely for tuberculosis itself, actually, we're missing 3 million cases each year, and part of them actually, of course, they are drug-resistant tuberculosis. So unfortunately, they missed from being enrolled in the system, and they missed actually from being enrolled to treatment. And of course, they're gonna increase transmission of this disease, and of course increasing mortality and death among this population.
Now, START is a website too, isn't it? So how do people use it, and what's your brief message about this?
Well, yes, it's a website actually, and it's free to everyone to log in and join it. It's in the beginning right now. But we are actually inputting many actually of the data inside there. So it's free for everyone. Any physician actually can just click to join, and he can be part of this big group of people.
So in a nutshell, could you sum up what you want us to take home from this?
I think the most important thing actually that we need people actually to be involved in this initiative. I want people actually to join us and probably put some input, and there are places actually inside this website that people can share their idea or ask the experts actually. So what we want actually, hopefully, that to disseminate this word, and so that many physicians can join us actually and be part of us.
Thank you very much.
Thank you. Thanks, sir.